Voyage.
We need to pump your stomach.
No, please,
We
let
got
me
you.
die.
Just hold still. Everything will be alright.
No, let me go.
Nurse, we need a sedative.
No, just let me die.
We'll be asleep soon.
Let me die.
Hey, this is Dr. DePersis at Green Community. Could you transfer me to Dr. Bruce Young? Tell him it's urgent.
More paperwork?
Drowning in it.
Speaking of paperwork, the lawsuit. You still haven't told us.
Okay. About a year ago, there was a patient in the hospital psychiatry clinic. Joe, his name was. Late 40s or so. He was an electrician, came in complaining about depression.
It's not like I've been having thoughts of ending things, Doc. I'm just sad all the time. Mood's down, got no motivation to do anything. Can't carry conversation with my wife anymore. It's unbearable.
Nothing traumatic happening in your life that could explain this?
Nothing.
Well, Joe, you have mildly elevated blood pressure, but that's normalized by the diuretic you're taking. No other medications causing your symptoms. You sleeping okay? Low energy, loss of appetite?
No, sir.
Well, let's get you a physical exam. Sometimes we think issues of the mind are confined to the mind, but we should check if there's something in your body that's causing this.
As long as we get to the bottom of things, Doc.
All right, Joe, good news. No jaundice, no abdominal tenderness, and there was no evidence on the exam of fluid in your abdomen. And just to check, nausea isn't one of your symptoms, correct?
No vomiting, sir.
Alrighty. Well, I'm prescribing an antidepressant, and you make sure to come visit me next month for a follow-up, all right? Martha at reception will get you sorted out with an appointment.
Thanks, Doc. Hopefully this helps.
When Joe showed up a month later, his depression was much better and he could function normally. And I believed him because...
You kept drawing tabs on him like a psycho.
You show up at his house in the middle of the night for the diagnosis or something?
No, see, in this case, I think I didn't care enough. I was distracted. Tommy was going through addiction, and Sandra and I were trying to figure out how to co-parent him. I let my personal problems get in the way of work.
We've all have things to deal with, and I've never seen you not care about a patient, even when you have something personal going on.
Regardless, with Joe, I missed something. All right, Joe. I think you can have your family doctor monitor you. I mean, I'd be glad to keep treating you, but I know Governor Calvert's a bit of a drive for you, isn't it?
40 miles. Yes, my family doc is right around the corner, so that works for me.
If you or your doc has a question for me, though, you got my number.
I do. Thank you, Doc.
I didn't hear from Joe again. Ordinarily, I'd have kept in touch, checked in on him, but like I said, I was distracted. He fell through the cracks. Apparently, Joe developed severe abdominal pain a few weeks after seeing me. He saw his family doctor for the pain and noted he had begun losing an abnormal amount of weight. Joe had also developed jaundice. The doctor ordered blood tests and a CT scan of his abdomen. Unfortunately, the CT scan revealed pancreatic cancer. I missed it, and the family doc didn't. And Joe? Well, I guess he blames me, doesn't he? Hello? Emergency privileges. All right, I'll come in. That was my med school buddy, Paul DePersis. Says he needs me down at Green Community for a case.
We're going to finish this conversation later, yes?
Of course.
Good, you should go. Wonder what's so urgent they need you immediately.
Bruce, good, you're here.
What's the crisis, Doc?
We have a severely distressed patient. She came to the hospital because of recurrence of pain.
What's the patient's name?
Grace Galanter.
Nice name. Alliterative. So, Grace came in with distress.
In severe pain in the abdomen, accompanied by vomiting. Her pain was so bad she tried overdosing. That's what brought her in here.
Must be debilitating for her.
She said the pain was an 11. Anyway, we evaluated her, got an IV in, the works. Problem is, her tests are negative. There seems to be no physical cause for her pain.
Pelvic exam?
Not yet, but nothing has shown up on the ultrasound or MRI.
You think it's psychosomatic?
Not sure. Would pain that's just in her mind be this severe?
It's rare. Let's get back to the overdose for a second. Was it only because of the pain, or...
This is why I called you in. No, She's also depressed. She says she's been on an antidepressant, but it hasn't been working lately.
What's she taking for the pain?
Cocktail of painkillers. But she says that isn't helping much either. You can't have her on sedation or morphine 24/7.
No. Need to get to the bottom of the cause of this.
That's why we gave you those emergency privileges. She's in room 314. I'll take you.
Grace?
Yeah,
My name is Dr. Young.
great. Another doctor being shoved in my face telling me they're gonna fix me and then not doing a damn thing to lessen my pain.
I'm sorry you feel that way.
Dozens of tests. Being poked with needles at all hours of the day. Every cocktail of meds you can think of, and the result? Pain. Still pain. Always pain.
Are you in pain right now?
Yeah. Oh shit. I'm not in the middle of a flare-up, so it's like a lurking in the background pain. But it's still there. Always there.
And when it flares up, you feel like you're on fire. Like your abdomen is being ripped open with a knife?
Yeah. That's a pretty accurate description. How did you know?
This isn't my first rodeo. The problem, though, is that feeling can be tied to many conditions.
Of course it can. So now what? You gonna go over all my other symptoms? Because I feel like I've already said it to a dozen people, a dozen times.
No, I've got your chart for that. I was actually going to ask you to tell me a little bit about yourself, your life story.
Why?
It helps to put the pieces of the puzzle together, so to speak, so I can see the whole picture.
Well, I'm no puzzle. What you see is what you get.
People like to say that, but we're all a puzzle, Grace.
Okay. I got married really young. My ex-husband was an abusive ass. I realized if I stayed, I'd just get pregnant, and there was no way I was bringing a kid into this world with that guy. So I left. But starting out on your own at 25 with no support from anyone, it's freaking impossible. Especially because I quit after my first year of university to marry Jed. I was just so stupid. Still am, I think. Or I wouldn't be here.
Go on.
I don't know what else to say. Life has sucked. After the divorce, I got work as a part-time receptionist at a realtor's office. I did that to stay busy and bring in income, but it's not a career. It's not a life. It's just plain depressing.
And speaking of which, is this when you started experiencing depression?
I think I've pretty much always been sad. Like, I was born depressed, you know? But clinically and officially, I was diagnosed 2 years ago when I was going through my divorce.
They gave you an antidepressant, correct? Did it work?
Sure, but only temporarily. A few weeks ago, the sadness and pain and exhaustion of my pathetic life, it all started coming back.
Is that when the physical pain started too?
No, that started in the last few days. Unbearable, could not move or think straight level pain, but the thing is it possible that the pain was always there and I just didn't feel it until now?
What makes you say that?
I don't know, like, I've always sort of felt hollow. But a few days ago, it went from hollow to full-blown, gut-ripping apart pain.
Have you ever had surgery of any kind, near or even around your abdomen? For example, for fibroids, or even back surgery? It's not in your file, but sometimes these things get missed.
I've never even been in the hospital until now. I'm at my wit's end. The pain is life-altering, and no one can tell me what's wrong with me. And now they've called you in because they think I'm crazy and making it up in my head, haven't they?
That's not why I'm here. Have you ever heard of a lenticular art piece?
No? What?
See, lenticular art uses a special lens to create a dynamic visual experience. So if I'm standing on the far side of the room looking at a lenticular art piece and someone else is standing right in front of it, we're going to see different things. The art piece is unchanged, but what I see and what someone else sees are two different things.
You think you can see something in my case that other doctors can't.
I think I'm used to taking an approach that most doctors don't. And I think that's what you might need. A different approach.
Fine. Just get this pain out of me.
Order 7204.
Tough nut to crack.
She's disillusioned with her life and can't understand what's happening to her. And who can blame her? Because we don't yet understand what's happening to her either.
So is the pain in her mind? Because we really can't find anything in any of her tests, and she's to the point where she's resisting getting more tests.
I don't think it's psychosomatic or psychogenic at all. I think something physical is causing her pain, but her depression is worsening it.
How do we cure it?
I'd like to transfer her to Governor Calvert. There are some cognitive therapies I want to try.
I'll get the transfer paperwork ready. Any other favors you want to do me?
I can't believe Dr. Young's being sued. How expensive do you think this is going to be for him?
I don't even want to think about it. Poor guy. He's had about a few years, hasn't he?
Divorce, son in rehab, now this? Wait, is he a Scorpio? The universe has really been coming for the fixed signs lately. I wonder if he has trines in his chart.
You spend way too much time on astrology TikTok.
What else am I supposed to do after interviewing serial killers all day? I need a hobby.
Well, ask your Astro influencers whether this Taurus is gonna hit it off with the Libra I'm going out tonight.
Ooh! Which date is this? The former child actor or Mr. Real Life Indiana Jones?
The archaeologist. He looks great on paper, but you know me. Zero hope or expectations.
Hey, at least you're still going.
What else is there to do?
Oh, it's Young. He wants me to help him on a case tomorrow.
That'll be fun. Or if not fun, at least educational, which can be fun.
You're such a dork.
Hello, this is Sandra.
It's me.
Oh. What's going on, Bruce?
Nothing. Is Tommy around?
No. He's out. I'm sorry, Bruce. He's not ready.
Okay. I understand.
I've tried to talk to him, too. He just needs to go through this the way he's gonna go through this.
He's not using again, though, is he?
You think I wouldn't know if our son was on drugs again? What do you think I'm...
Well, you didn't know the first time. I'm sorry. That wasn't fair. Neither of us knew.
Bruce, you don't sound like yourself. What's going on?
I haven't been sleeping.
Work's stressing you out again, isn't it? What is it now? A patient? A case?
Oh, it's a case, all right. A case against me.
Sorry, you're breaking up. Can you say that again?
It's nothing. Never mind. I just wanted to check in on Tommy. And on you. Just... yeah.
I'll let Tommy know you called.
Thank...
A lot of people think my life is like a movie. Mostly I'm just hanging out in museums or covered in dust all day on a TIG that yields nothing. But once in a while, it's worth it. What about you? You're out there saving lives. That's way cooler than what I do.
I'm a psychiatrist, so not exactly stitching up war wounds or anything, but it's fulfilling. Hard, but fulfilling.
What kind of psychiatrist are you again? I've always found the field of psychology fascinating. What? Why are you looking at me like that?
Just... a lot of guys I go out with only talk about themselves. They never ask me anything about me. Pretty sure the last guy I went out with didn't even know I was a doctor.
Well, what's the fun in that? If I only wanted to talk to myself, I'd talk to a therapist. Oh, wait.
I shouldn't have agreed to come here. I thought I was going to get to go home, and now I'm at a different hospital. My neighbor broke her leg, and I've been looking in on her, and I can't check in because I'm being shuttled from hospital to hospital.
I transferred you to my unit so we can start cognitive behavioral therapy. This is Dr. Hickson. She's going to be monitoring you.
You think I'm making this up, don't you? But it's all in my head.
Definitely not. I believe you are in physical pain, and we have to find out why. But you were brought into the last hospital because you overdosed, and you agreed to the 72-hour hold. We need to make sure you're not in the mental state to take your own life again.
And this is a much nicer place to serve out that hold than the community hospital. I mean, the bathrooms alone.
Yeah, well, I told Dr. Young what my life is like. I'm in constant, chronic pain. You know, maybe I'm cursed. When I was a kid, my grandmother told me about this curse that affected the girls in her Hungarian village. You see an owl before you die. Well, I live in an apartment complex next to a freeway. There's no trees. I rarely see any birds, period. 2 nights ago, around midnight, I saw an owl staring at me, perched on my balcony.
You're not going to die. I'm going to help you. Now, lie down and close your eyes. I'm going to ask you a few questions, and you're going to respond normally. You mentioned the antidepressants helped you at first. Can you remember your emotional state when you first started antidepressants?
I wasn't happy, but I was more functional. I filed for divorce because I was confident I could handle going through it.
What happened after you felt the antidepressants stopped working, when the pain started?
That confidence washed away completely. I realized the truth.
The truth?
I couldn't handle my divorce. That my pain was never going to go away. That my life was always going to suck and there was nothing I could do about it. I am destined to be unhappy, and nothing I do is going to change that. The pain. The fact that no one can find it makes me think that it's fatal. Whatever it is, I can't live with it. And even if I tried, it'd probably kill me in the end anyway, so what's the point? Medication doesn't numb the pain. Sometimes it's so bad I can't think. How can I live this way forever?
You won't have to live this way forever. We're going to find out what's causing this.
Was that wise? To promise her we'll find out what's causing her pain? Because so far, all the tests have come up clear.
I know, but you saw her. She's fatalizing and negative in her thoughts. But there has to be something physical going on here. And after what happened with Joe.
Okay, I'll run some more tests.
And I'm going to dig into Grace's personal story a bit more. Maybe there's something there I missed.
Dr. Purcell, GP is on line 4. Whoever is paging Dr. Purcell, GP
So
is
how
on line
was it?
4.
Surprisingly, he was great. We're going out again tonight.
The last time you went out on a second date, Columbus was discovering the new world.
Hilarious.
I'm glad, though. You deserve to end up with someone great.
No, I think we're jumping the gun on end up with, but this guy definitely has potential. Okay, I gotta go get ready.
Good luck. I want all the deets tomorrow.
It's great to see you again.
Likewise.
You had a thing at the museum today, right?
Yeah, was supposed to get assigned to this dig in Somalia that I really wanted. Didn't get it.
Oh, I'm sorry. That's really...
I don't want to talk about it.
Okay. We can talk about something else.
I'm really not feeling like eating. Can we just go back to my place?
What? We just ordered.
It's just been a really shitty day. I really want to end it with you and me, somewhere where we can be comfortable.
What if I'm not comfortable?
I could cook. Come on, let's go.
No. Let go of me. What is wrong with you, Leo?
I'm sorry. I don't know what's wrong with me. I guess I'm just frustrated with what happened today. I didn't mean to grab you like that. Forgive me.
No, because I see it now. The best behavior, cool guy, is the act. This is the real you.
Alyssa.
Bye, Leo.
Come in. Dr. Jones, how was the date last night? Second date, right?
I forgot how much Hicks likes to gossip. Yeah, it was terrible. The guy had anger issues. I have the worst luck. Maybe I should go to a shaman and get the curse that I'm under removed.
One of my patients said they're cursed too. Neither of you are cursed. Life just sucks sometimes. Hicks, what did we say about entering without knocking?
Why? What are you even doing in here? Anyway, I heard from the lab that we got Grace's results back. What did they say?
Nothing. No blood disorders or anything. But I researched Grace, looked up her divorce, and I found that her ex put her in the hospital several times. She lied earlier when she said she'd never been in the hospital.
Wait, if she had an abusive ex, her pain could be residual from physical abuse.
It's possible, but why wouldn't the effects of residual wounds show up on any exams?
If she lied about never being in the hospital, what else has she hidden from us? Maybe we should extend her
Wait,
cognitive...
what did you just say?
She's hiding things from us?
The irony is she said she thought she was cursed.
Dr. Young, you're on page 20, and I'm still on page 1.
Come with me. We're going to go talk to Grace right now.
About what? What?
That man needs a leash.
Grace, I suspect you have what we call an occult issue.
I'm not a witch. I mean, I go to tarot card readers sometimes, but that's not really the same thing.
Occult doesn't mean witchcraft. Not in medicine, anyway.
In medicine, the word occult means hidden. For example, sometimes people have conditions like occult endometriosis, which is endometriosis that can't be easily detected by the usual tests.
There's dozens of types of occult issues. The only way we can figure out exactly what this is through exploratory surgery.
It's a keyhole surgery and will leave minimal scarring, but it is still a surgery.
But will it help diagnose the problem? And if the surgery figures out what's wrong with me, we can work on treating it?
Yes.
Can we do it now?
I'm glad you're game. There's some paperwork to sort through, but we'll get you to a surgeon as soon as possible.
So I'm going to be okay?
Yes. Your surgeon, Dr. Crescent, good doc that one. She found occult endometriosis growing outside your uterus. She cleaned up the endo, which should give you significant relief from pain. She's also prescribed birth control that'll help the endometriosis.
Dr. Young, I'm sorry I lied to you about never being in the hospital before. I was just... Oh.
I understand, but we got through it. We're going to continue cognitive behavioral therapy till you're back on your feet. It'll be outpatient, so you can stay home, check in on your neighbor and such.
For the first time in forever, I actually feel...
Happy?
I was gonna say hopeful.
I'll take it. Excuse me, Grace. Hello?
You're being sued? When were you going to tell me?
The Mind Doctor is a production of Voyage Media. The series is produced by Nat Mundell, Robert Midas, Dan Benamore, and Alyssa Goodman. Executive produced by Dr. Peter Hartman. Inspired by the life of Dr. Peter Hartman. Directed by Alyssa Goodman. Written by Minodi Vaishnav. Starring David Pinion as Dr. Young, Meg Hensley as Dr. Hickson, and Sixta Morel as Dr. Jones. Additional cast credits available in the show notes. Edited, sound designed, and mixed by James Scully. Original music by Derlis Gonzalez. If you're enjoying the show, please leave us a 5-star review on Apple Podcasts, Spotify, or anywhere you're listening, and subscribe now for future episodes.